going to look at 3 adjunctive techniques that are available to us: vital tissue staining, chemoluminescence, and autofluorescence. So we'll look at vital tissue staining first of all. And this is a process of staining living tissues or living cells. We've got toluene blue, which is a metrochromatic vital dye that has been used for more than 40 years to aid the detection of various conditions. And the reason why it's so useful is that premalignant and malignant cells contain significantly more RNA and DNA compared to normal cells. So areas that stain dark blue are considered a positive stain, and they require further investigation. And we will be, as we go along, we'll be talking about products that are available in the UK that we can use. So one product that is involving, which is vital tissue staining, is produced by ADENT, the oral blue oral lesion marking system. And there are other products which does this, but the main thing is it's got toluene blue in it, or toluene chloride. It's got acetic acid and also applicator swabs. And the acetic acid is essential because what it does, it helps to remove surface debris. And a positive test is if the dye is retained following an application and destaining with acetic acid. So that's one technique that is available. A second technique is chemoluminescence or tissue reflectance. And again, it's been used in medicine for many years to detect premalignant and malignant lesions. And this technique has been adapted for use in the oral cavity. A chemoluminescent light is used to access the oral cavity after rinsing with, again, acetic acid. And by applying the acetic acid, it results in surface coagulation of cellular proteins and dehydration. And the net effect is it reduces the transparency of the epithelium. So let's see this in action. The next slide shows what can be done with chemoluminescence. And it's very important when this is done, the mucosa, the area is investigated under blue-white illumination. So when that is done, abnormal cells appear white or aceto-white, whilst normal cells appear bluish because they absorb light. And because malignant cells have increased light reflectance compared to normal cells, and because they have a higher nucleus to cytoplasmic ratio. So this is what we can see is the difference. So we see in the first image an indistinct white area on the left buccal mucosa. In the second image, after an acid rinse and illumination on the blue-white light with a chemoluminescent device, we see it. So there is a product that is available that can do this for us, and that's it's the Microlux Trans Illuminator. Again, ADENT has produced this device, and this is a multi-purpose device that can be used to screen for caries, fractures, and occlusal mucosal abnormalities. And it has a number of tips. So it contains an LED fiber optic source, and then you put the various tip on for the various application. So if you wanted to use it for chemoluminescence, you would apply the diffuse light guide, the DL guide, and that would generate the sufficient luminescence so you could visualize mucosal abnormalities. I should have asked, has anybody got any of these tools? Please speak. Has anybody seen any of these tools or got any of these so far? Or tried any of these out? No? Nope. I like my gadgets.
I've used them all.
Okay.
And the ones I think you're going to come on to mention.
Yes. So we're going to spend the jury, well, they're available, these tools, okay? So the final technique that we're going to look at is autofluorescence, and many of you have probably heard of this or got products. And what is it? Well, cells and tissues, I'll just admit this person, contain molecules called fluorophores. And when fluorophores are excited by light of a specific wavelength, particularly blue/violet light, which has a wavelength of between 400 to 450 nanometers. Fluorophores will emit their own light source, light at a longer wavelength, which is green light. And this phenomena is called autofluorescence. And loss of this tissue, autofluorescence, has been associated with malignant and pre-malignant lesions. So the next slide just depicts this. So we see here in this slide the interaction of blue-violet light with normal and abnormal mucosa. So when cells or tissues are viewed under an optical filter, it allows the passage of long wavelength red and green autofluorescence. So typically, healthy tissues will appear green. They'll emit the fluorescence, while abnormal tissues will appear dark. And this we said because of the changes, the dysplasia and so forth, the changes in the cells, which allows this phenomena to happen. So this is an example of a device that's been used. And one of the things about, unlike the previous adjuncts, you don't need to use any dyes or so forth before using this device. And there's many studies that have looked at the use of autofluorescence devices, quite a few papers to send you if you do contact me or Professor Lewis on the use, and many cancer centers are using this routinely just to observe things. So we can see here a screening device was used, and it revealed loss of fluorescence in one area in the retromolar region. And in this particular case, a biopsy was taken, because these are not diagnostic tools. Okay, so further investigation is needed, and then the patient got the necessary treatment. So there are currently 3 autofluorescence devices that are available in this country. We're just going to briefly look at these in turn. So the first, I'm sure many of you have heard of this product. I should have done polls. Prof Lewis did polls. has anybody used the Velscope?
Yep.
Yeah, Brent. Anyone else? Okay. So Velscope stands for a visually enhanced lesion scope, and that was really the first autofluorescence device used made available in dentistry. The latest model is shown here, the Velscope VX, and what it is, it's a blue light source that is integrated into the handpiece with an optical viewing filter, and you can get as an optional accessory an image adapter, so you can take a picture of the image of what you've seen, and it allows you to just document what you've seen. So that's the original, the Velscope, and they've had various iterations, and this is the latest one. So that's one. Another device which is similar, but it's made by a different company, is the BiScreen. It's a bi-fluorescence screening device. Again, you have a viewing, you have to view the area, so you've got a viewing screen, and then you can use this device in full light due to having 5 violet high power LEDs, which is beneficial. It again also has adapters that are available, so you can use an SLR camera for your SLR cameras, or you can use a phone adapter, so you can again document it. So this is the final AF device that is available. It's one of the latest devices, and I've had the privilege of trying out all of these products. It's one of the joys of testing products. You can try them out. And this is the Goccles device. Has anybody heard about this device? The Goccles device? No? Okay. Well, yeah. Again, yes?
I was, in fact, involved in some of their posters. I was using it about 2 years ago. So I think you'll see some pictures around. If you put that into Google Images, yes, there's a picture of me using it in the clinic, I think. I looked the other day.
Excellent.
Anyway, sorry, Andrew, I'll let you carry.
No problem, no problem. It's quite a nice, again, it stands for something. All of these devices stand for something. So it stands for glasses for oral cancer curing light exposed screening. And this was really designed, this product was designed to create an easy and low cost method to visualize oral mucosal abnormalities. And it consists of a pair of glasses that are equipped with filters, which the user will wear. And then you use a normal curing light on any area. So it allows for vision that does not, binocular vision, and doesn't need any consumable products to function. So that's one of the benefits that this device has, is glasses, especially laser users who are used to wearing glasses, and they're quite pretty nice glasses actually. And this device comes with a smartphone camera lens clip, which allows for photos to be taken. So it's just a different way of assessing tissue abnormalities. So to effectively use autofluorescence tools, but particularly any tool, it's or any adjunct, it's very important that we know how normal phenomena appears when viewed through an optic filter. We don't want false positives, so there is a learning curve. And so the Velscope website has got excellent training materials about which I would encourage you to look at, especially if you are looking at getting an adjunct technique. It's a free resource which is excellent to get some more information on it. Now, in tonight's presentation, we've briefly given an overview of the adjunctive techniques that are available. There are a number of papers on the subject, which I'm happy to share the references with you. And if you want more specific information about the products that have been mentioned, there's the details of various companies that have produced these products. You've got the website and contact details, because they can send you more information. The purpose of today was to give you an overview of what was available, and there are a few others available. These are the main three, I would say. And perhaps when we have the panel discussion, we can talk more about that. But this is crucial that we understand this, that adjunctive techniques have been developed to assist healthcare professionals to detect oral mucosal abnormalities. These tools do not replace or diminish the mouth cancer clinical examination. They do not do that, but they should be used, if we are going to use them, to complement and strengthen existing clinical protocols. We need to have clinical protocols. We need to document things, especially the powers that be. We need to document things because it's such a debilitating condition. And they were not designed for diagnosis, these techniques. And as we've said, with any new tool or technology, there is a learning curve, and we need, as professionals, to properly use them. We need to invest the time and to learn how to use these tools or gadgets effectively. So, early detection and diagnosis of mouth cancer dramatically improves survival rates, and it also makes the treatment and rehabilitation easier. Systematic and regular screenings saves lives. As healthcare professionals, are we doing our part to raise awareness of mouth cancer? And that's my bit done. Thank you very much for joining us tonight. There will be a panel discussion. If you want any more information, that's my email address also.